start recording the meeting or the lecture, and then I'm going to hit share.
Okay.
All right, so
you want me to put it on mute right now?
oops, I don't know what I just did.
Look like you're sharing right now.
Yeah, I didn't mean to put that. 1 second.
Okay.
Okay, so we're going to share this. Now you can see it says strep throat.
Yes.
Okay, all right, yeah, all right, then we're good to go. Then I'm going to go ahead and just make this full screen and then start lecture. All right?
Okay.
All right. Now go ahead and you can put yourself on mute unless you have any kind of questions or anything.
Okay, I'll put myself on mute.
Right. Okay, so the first thing with strep throat is we want to be able to understand what it is, how people become infected, and what the treatments are, and what the signs and symptoms are. Strep throat is a bacterial infection, so that tells us that it is going to be able to be treated with antibiotics, which that's good, right? But and what we see when we see a patient who has strep throat is usually what the classic signs and symptoms is a cherry red, bright throat. And that's from the strep. The strep's causing that. Their throat feels sore, it feels scratchy, it probably hurts to swallow. And a lot of times we see with small kids that it even causes them to have an upset stomach and so forth. Strep throat is very treatable nowadays because now you get strep throat, we go in, we get antibiotics, and we finish our antibiotics, and it doesn't progress and go on and become worse and invade the body. But in the old days, and still sometimes in very rare occasions, strep throat can lead and become what we call systemic throughout the body. And it can lead to a disease called scarlet fever. And this is a scarlet fever rash that we're looking at. And with scarlet fever is really high temperatures, unable to control, and can require hospitalization. So back in the old days, before antibiotics, strep was bad because it did most of the time lead to complications like scarlet fever. Sometimes with strep throat, you might have pain that's not just in the throat, but it may be sinuses in the ears. People might have chills, fatigue, loss of appetite, feeling tired. That's what malaise is tired. And then, like I said, it's very common with kids to have nausea and vomiting. And then one of the other things we see, if it's a severe case, the lymph nodes right through here might even become swollen. The tonsils can become swollen. And with extremely rare and severe cases of strep throat, I have heard of people being hospitalized because they worried about their airway because the tonsils and everything was so swollen from the infection. All right, we're going to move on and talk about the cold. There are literally millions of different viruses that fit into the family of the common cold. All right, it's not the same as the flu. Okay, a cold is a completely different type of virus, and it usually gives us really mild signs and symptoms. Those signs and symptoms are like sneezing, maybe a little bit of post-nasal cough. Like the only reason you're really coughing is because your nose is dripping down the back of your throat. And just red eyes and feeling tired, maybe a tiny, tiny bit of fever. But it's usually something most people can go to work with and deal with while they have a cold. How is it spread? By sneezing, touching things, objects, kids putting things in their mouth. And because there are so many types of cold viruses, the symptoms can vary from person to person to person, right? And then this is going over the signs and the symptoms that I spoke of. And what's the treatment? Fluid, drinking lots of water, getting rest when you're able to, and avoiding alcohol, caffeine. And then it has been proven that taking vitamin C and zinc, like Zicam or Cold Ease, actually can help shorten the duration of how long your cold lasts for. There is a very important thing I want to talk about right now, and we'll talk about it more when we do pharmacology. But anyone that is under the age of 18 should never be given aspirin. And one of the reasons is because aspirin is can lead to a syndrome called Rise syndrome. And this can be life-threatening in young children. And we know that some of the factors with when, say, a child had a cold and they didn't feel good, so their mom gave them an aspirin, and then they ended up developing this Rise syndrome, which is really severe, causes all kinds of multi-symptom and multi-system complications. So now that we know that over, as the last 40 years or so, we know never give children aspirin at any time. Now, once somebody's over the age of being, what do you call, 18, 19 years old, then they're fine. They're good to go. They can take that. But sometimes with certain colds, you might want something to help relieve. Maybe you got sinus pressure pain or a little headache from the cold. So some type of pain reliever. But Tylenol or ibuprofen would be fine for a child. But like I say, with kids, always consult with your pediatrician first. Okay, now we're going to move on. We are going to talk about the flu. So flu season is coming. Yay, during a pandemic, woohoo! The flu is viral, and that means there's no type of real treatment besides an antiviral. Now, over the years, antiviral, in the past few years, have become more and more common practice. But it's before, I'd say maybe 5-6 years ago, it was very uncommon to be given an antiviral. They told everybody, write it out, stay home, stay in bed, drink lots of fluid, and take care of yourself. But nowadays, a lot of people are not able to stay home. They're not able to miss work and this and that, and that they give them things like Tamiflu and stuff like that to help shorten the effects of the flu. The flu can cause headache, all of the common symptoms we associate with a cold, but the difference is it usually will cause a high fever. Another thing that you'll see with the flu is you will feel drained, very, very fatigued. You might even have pain in your muscles and your joints. Coughing and vomiting can occur as well. With most healthy adults, you can treat yourself for the flu by, staying home, over-the-counter anti-inflammatories and pain medicine, and lots of hydration and rest. And then usually within a week, you're feeling better, you're back to normal. All right, we'll move on. The next thing we're going to talk about is Legionnaire's disease. And there's several videos I'll be posting to teams once we're through, and it will cover, give you like a little animation of what we've covered. I have one for the flu, and I have one for the common cold, and I have one for Legionnaire's as well. Legionnaire's is a disease like pneumonia, and it is caused by the Legionella bacteria. And here's where it's kind of unlike most bacteria, because it is spread through water and mist of water. So like fountains or air purifiers, those sort of things. So most people, if you're young, you're healthy, you have a good immune system, you get this and you're going to feel bad for a week or two. But older people, they usually don't do as well with catching this. It is not transmitted person to person. So only somebody who has been exposed to those water droplets, the mist that is infected, can get it. And this is a video I'm going to share with you. All right. I know I'm moving kind of fast, but remember, you can always go back, rewatch, pause, take notes. Pleurisy is basically inflammation of the pleura. And we learned that the pleura is what houses the little covering around the lungs. So pleurisy, it also could be called pleuritis, because that's what it is, inflammation of the pleura. Well, I can let you know pleurisy is painful, because what ends up happening is, instead of having that normal lubrication for the lungs to expand and breathing to occur without any friction, when pleurisy happens, that the pleura gets inflamed, and every time we breathe, it's like a rubbing and grating type of thing. So it's very painful, very painful. Signs and symptoms might be shortness of breath, cough, fever. What usually is, like I said, because of the pain, the doctor will say, hey, let's get you an x-ray, possibly even a CAT scan, and let's check and see what's going on. And if they say, okay, well, you got pleurisy, then they'll probably prescribe antibiotics and cough medications and stuff like that to help you as far as getting over. Michael, you can close that other one too, sweetheart. The next thing we're going to talk about is pertussis. And most of y'all who have kids are aware of what this is. This is one of the vaccines that our kids get, and it prevents whooping cough. And whooping cough, or pertussis, you should note that these mean the same, is caused by Bordetella pertussis, and it is a bacteria. And now, way before we had vaccines and antibiotics, this would go through a town and take out, 20, 30, 40, children in a town of 100. So it was bad. It is highly contagious because it's a respiratory disease. And what ends up happening is that a patient who develops pertussis, or the whooping cough, starts to uncontrollably cough. And this coughing becomes so severe and so constant, they're not getting proper oxygenation. And so it's cough, 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 and then a gigantic gasp. And that's where the whoop comes in, because it sounds like it. If you've ever heard a baby who's had it, it's heartbreaking. And I'm not trying to be mean, but I am going to post a video so you can hear what it sounds like. And the best way we can treat this is by preventing it, getting our children vaccinated for pertussis. Now, sometimes we know vaccines are 99 point thing, but where's that 1%? So that maybe that 1% somebody does get it. We can treat it. We can treat it with antibiotics. And they usually require hospitalization, antibiotics, steroids, and a bunch of other breathing treatments and stuff like that. So the best way is to prevent by immunizing. And then that's a sounds of pertussis. I'll show you the video. All right. I said, we're flying today. Pneumonia. Pneumonia is tricky because pneumonia can be bacterial or viral. There's even fungal forms of pneumonia from what I understand. But what pneumonia is when your alveoli or your little air sacs become filled with fluid. All right, we don't want that. We don't want your alveoli with fluid, because then are they going to be able to transfer and pass the oxygen that needs to be happening? No. You are more likely to develop pneumonia if you've had a cold, if you've had a flu, or if you've been bedridden, or any type of respiratory issues. This is why I always say that anyone who has to go into the hospital long term, pneumonia is the scary thing. Because if you're in the hospital, you're usually not well enough to get up and move. And when you're not moving, you have a higher chance of being flat. Your lungs are not moving. You're not moving around as much. And pneumonia can develop, especially in a hospital type of situation. And we call when somebody, say like Mama goes in because she broke her hip. And she's there, she can't get out of bed, she's got a broke hip. So she acquires pneumonia or some infection because somebody brought it in, wasn't clean, something wasn't done right. We call that a nosocomial infection. And those are what take down a lot of people. We are seeing that with COVID right now. Pneumonia can take 3 to 7 days for it to show up. And this is showing you, if we were looking at our normal alveoli through a cross section, and then alveoli with pneumonia and how it's full and it's not able, and the fluid levels, it's not able to do its job. And there's another picture, and you can see how this would be difficult to breathe. Now, bacterial pneumonia usually presents with the same signs and symptoms, but we see that these patients a lot of times will run around a high fever, having chills, shallow breathing, nausea, vomiting. And if we know that it is bacteria, because say we've got a sputum sample where we've had the patient cough in a little cup and bring up the contents from their lung. And I'm going to post don't watch this if you just ate, but I'm going to post a lab video, and it's how to collect a sputum sample from a patient. But they run that, they culture it, and they find out, oh, okay, that's bacterial. So we can go ahead and give antibiotics and treat the patient and so forth. And viral, it's got to run its course. There's, of course, antivirals, but it still doesn't just magically take away the pneumonia. And these patients will have a fever, cough, shortness of breath. There's usually little mucus, very little with viral, whereas with the bacterial, there's lots of mucus. And this is a word that you should be familiar with. It's called lethargy or lethargy. Same difference. And that means that the baby just seems kind of lifeless. And that can be in people, but we see this a lot in children and babies who have pneumonia. This is the x-ray, and this x-ray, the cloudiness that we see here shouldn't be here. And that's because this lobe of the lung right here is infected with pneumonia. All right. The next thing we're going to cover is pulmonary edema. So what is edema? Edema's swelling. No matter where it's at, it means swelling. You can have, that last month of pregnancy, how your feet swell, that was edema. Or if you wear a ring and you get stung on by an ant or something on your finger and it swells up and you can't get your ring off, that's edema. Any kind of swelling is edema. So we can imagine we would not want swelling in our lungs, because what ends up happening is pulmonary edema is caused by excessive fluid. And we see that sometimes with the pneumonia. So not only do you have the fluid buildup and everything, and now you're having an additional complication of it with the swelling of the entire pulmonary, like the lungs and so forth. Depending on the cause of pulmonary edema, it could be different. Is it always because of pneumonia or some infection? No. Sometimes pulmonary edema happens because of damage to the heart or something dealing with circulatory system and that kind of thing. Sudden or acute, people who have this sudden or acute pulmonary edema, they are going to be short of breath. The dyspnea or difficulty breathing is going to be really, really bad when they're laying down. So what you'll see is all the patients that I saw with this, they always wanted to be set up straight. If you tried to lay them down, they felt like they were drowning. Wheezing, gasping, anxiety, a fear of real restlessness, because they're basically not oxygenating properly. Okay. And sometimes you'll even see an irregular heartbeat or heart palpitations with this. Long-term or chronic edema, they may notice this when they start becoming physically active, anytime they become exerted, when they're laying flat. People who have chronic pulmonary edema, you'll notice they don't ever sleep flat. They're always propped up with pillows, or they have one of the elevated beds. And like I said, we see this a lot with congestive heart failure and other cardiovascular related issues. You also will see swelling and that edema in other parts of the body as well, like the hands and the legs and the feet and so forth. And then this is showing you an example of a normal set of lungs versus a lungs with pulmonary edema. And you can see how that would not be something you'd want your lungs to be full of. Other things that can cause this is exposure to certain chemicals and toxins, like smoke inhalation, like if were caught in a fire, or near drowning where your lungs were full of water. That could be a cause as well. This is what I was talking about. This is a classic sign of edema. And this is probably some pregnant woman who's just about to deliver. For whatever reason, our feet just start swelling anytime you're on them for too long at the end of your pregnancy. And that's what she's doing, is this nurse or whoever is pressing that patient's foot, and she'll take her finger and move it. And sometimes they'll measure how deep it is. And with people who have chronic conditions with edema, it's called pitting edema, because it looks like it leaves a little pit, and they'll measure and see how severe it is. Treatment, O2, a diuretic. Why would we want a diuretic? We'd want a diuretic because what do? They help us urinate. So it's going to help remove fluid. Narcotics, if there's pain, blood pressure medication, and a change of lifestyle. Patients smoking and not eating healthy, they're overweight. The doctor's going to tell them, hey, you want to live? You're going to have to start doing these things to get to reverse this, to get back to a healthy condition before the pulmonary edema. Yes, that was me. Everybody goes, oh my God, was that you? Yes, and that's my daughter, and that's Brian, and that's my oldest, and this was their dad. And I have a picture of this because this is what he passed away from, as a pulmonary embolism, or what we call a PE. And what a PE is a condition where you get a blood clot, which is called a thrombus. And it is usually in the lower limbs, like the legs. It can be in other places. But that thrombus, for whatever reason, breaks off and starts traveling. And that's when it becomes, when it becomes moving, it's embolus. All right. And what ends up happening is it's going to make its way to the lungs and the heart. And what ends up happening there is the body is not able to process, depending on the size of the clot and that kind of thing. And it can, and like, unfortunately, with my husband, it led to his death. And pulmonary embolism occurs because, like I said, because of thrombus, because of some patients have a condition called DVT. It's called deep vein thrombosis. And they make blood clots because of either having a stationary lifestyle, not being able to move enough, or sometimes it's genetic. Occasionally, these can happen because of a broken long bone, like a femur bone, or a tumor, or even an air bubble. But most commonly, it's due to high blood pressure, and it's due to people who have a really bad tendency of sitting with their legs crossed, wearing extremely restrictive shoes, sitting with their feet twisted, you know how you wrap your feet around the back of your chair. All of those things can make you more prone to blood clots. Their dad was horrible about constantly crossing his legs and wearing tight shoes, and he had high blood pressure. And actually, he was taking a plane trip to go look at some new fire trucks in North Carolina, and he must have, the plane has a pressurization, and that clot probably formed there. And then he had flown home, and a couple of days later, he was out fishing, having a good time, and he jumped in the water. It was hot. And when he jumped in the water, there's another repressurization that just occurred, and he didn't come up. And his friends that were with him at the time, and my middle son, they jumped in, got it, pulled his life vest, and he was immediately came up, but he was already, by then he was gone, because he had the typical signs and symptoms of what we consider, like with an emergency PE, the pink frothy foam, and it tells us that our lungs, they've given up. And they like I said, of course, they still tried. They took him to the ER. They did everything, but it was one of them things that he wasn't able to be saved. And we know that now. We've come to terms with that. And that happened in June 24th, 2007. So it's still one of them things that it always kind of sticks with you, but time does heal. And one of the things that I've kind of put myself to doing is educating people. If you can, don't sit with your legs crossed. Don't wear constrictive, tight tying shoes. If you have to take a plane ride, move your feet. If you can't get up and down, piddle paddle your feet up and down, like the because any movement is going to prevent that. How many of you, if you've ever had a surgery, that was always a real big complication post-surgery is pulmonary embolus, PE. Nowadays, somebody came up with this really awesome device. When you go to surgery, they wrap these devices around your leg, and the entire time during surgery, because when you're in surgery, the blood's not really flowing through to the legs. So what it does, and you're not moving, you're not circulating it as well. So what this device does is it contracts like this and continues to force and make the blood circulate. So it really cuts down on chances of complications during surgery. And this picture here is talking about sometimes people can catch an embolus. So, because all an embolus, remember, a thrombus means it's stationary, still attached, and this picture shows that. And then the embolus is if it breaks off. Now, sometimes people get lucky and they're able to catch this, have surgery, fix it, reverse it, and be put on blood thinners and change and modify their living styles and go on and live normal life with modifications. But usually, like I said, if it gets caught up and it's made its way to the lungs, it's usually not a good outcome. And this is usually what ends up happening. And you see the blood flow is not returning to the heart. The symptoms can be no symptoms. And I have, I've had to go through lots of self-forgiveness because I was paramedic, medical, all this. And the day before this happened, I noticed that he was real diaphoretic. And what diaphoretic means is sweaty and clammy. And that's a symptom. And he also had complained of a pulled muscle in his calf. And my brain and my guilt was like, I should have realized that. I should have put two and two together. And I had to, with therapy, I realized that's not my fault. I'm not a doctor. Even if I was a doctor, that's still not something that even maybe a doctor would have caught. So, but the symptoms are usually, clamminess, sweating, pain at the site, redness at the site where the thrombus is. So those can be helpful warning signs. So if a patient does have those, they can go in and have it treated and prevent that thrombus from becoming an embolus. And then that's the shortness of pain and the cough. The coughing usually will be pink or foamy if you see that. The risk are heart disease, cancer, staying in bed for too long journeys, like flying long ways. And then here's another thing. And this is, like I said, the best thing I can do to heal with everything is teach and explain. If you're going on a long trip, who do you think we see in the ERs and that have a lot of pulmonary embolus are thrombus blood clots. Truck drivers. Why? Because truck drivers are sitting and they're driving and they're not really moving. What leg do you think almost 90% of them have it in? Their left leg. And the reason is because it's not doing anything. So they're driving. And so what we have to do is we have to remind ourselves, long journeys, get out and walk around. Don't, if there's a rest stop, get out, get up, move, stretch, circulate. Even if you're a passenger, move your legs around. Constantly keep yourself circulating and moving. And one of the biggest bits of advice that I can give y'all is at home, don't sit with your feet crossed. Get in the habit of keeping both legs out, especially if you smoke, especially if you're overweight, especially if you're on birth control. These are all things that increase your risk factors for thrombus and blood clots. What are the treatments if we catch it? Blood thinners. And then actually they have some really cool drugs called thrombolytics. One of them is TPA. They can go in there, inject it, and it's like a Drano for the arteries, and it busts up the clot. And then sometimes surgery is needed, and other times filters. And the little filters will, people who have lots of them, they'll put certain like little mesh filters to prevent the blood clot from moving, say if it's in their legs or whatever, and so that if the complications would be isolated to the lower extremity and not be able to make its way up through the system. It's 40 minutes and we're going to stop here because 30 minutes is usually everybody's attention span. But I am going to post the coronavirus video because SARS is severe acute respiratory syndrome, and it is a coronavirus. And we had a gigantic outbreak of it back in 2003. And now, hello, we have another coronavirus, and it's called COVID-19. And it is in the same family, they're cousins, because they're both coronaviruses. And all that really means is that they're crown-shaped. But I'm going to post a really interesting video for y'all. I hope y'all watch it, and we'll continue with lecture on Monday. Remember, this mod's fixing to end. So that means you need to have your work caught up. And I know I said 1 o'clock. If you still haven't turned in your homework, this is your task. Go ahead and get it in. Depending on how late you send it to me, it might be a couple points off, but it's so much better than a 0. If you haven't done your Survey Monkey, that's me giving you the eye. Get on it. Make sure you send me a screenshot, and y'all have a wonderful weekend, okay? Anybody have questions? Nope. Bye, guys.